Australia is in the midst of a whooping cough outbreak, with at least 3,000 cases recorded so far this year. That is the most since 2019. Queensland and New South Wales have seen the bulk of the infections. Queensland's Acting Chief Health Officer, Catherine McDougall, joins us now from Brisbane. Good morning, Catherine. How are you?
I'm well, thank you. Good morning.
Great to have you on the show. Catherine, why is the infection rate so high? Why are we seeing so many cases now?
I think the first thing to say is that pertussis, or whooping cough, is a highly contagious infection that can be particularly severe in young babies less than 6 months of age. And for that group, the best protection is vaccination in pregnancy. When we think about why there's so many cases right now, there are a number of factors. The first is that pertussis is known to run in cycles every 3 to 4 years. And as you mentioned, our last cycle was in 2019. Additionally to that, for a 2-year period during COVID, there was very little pertussis on the ground. And that has effect on long-term immunity of the community. So with that and vaccination rates lower than we'd like them, it's certainly some of the causes for why the numbers are so high now. We're worried about it in Queensland, but we're worried about it nationally, and the best protection is vaccination.
You mentioned that vaccine rates are lower than they should be. What is the vaccination rate right now?
So when we think about vaccination rates for whooping cough or pertussis, broadly we think of 3 groups. As I mentioned, the best protection for the smallest babies, the most vulnerable, less than 6 months of age, is vaccination in pregnancy. And over a 10-year period, we have demonstrated that our vaccination rates in pregnancy have gone from about 50% to 75%, but have remained relatively static at that level since 2016. This is important because large data studies show that if you get a vaccine in pregnancy, you decrease the risk of your baby getting pertussis in the first 6 months by 76%, which is hugely significant. The second group that we're very keen to ensure are vaccinated are all children. The good news is that vaccination for pertussis is part of the national program and it's free, but we need all our kiddies to be up to date with their vaccinations to best protect them from whooping cough. And then for adults or the general population, your immunity does wane, and so you need a booster every 10 years.
Okay, so a booster every 10 years is required. What do you say to parents about how to identify if their child or their baby has whooping cough? How does it differ to a normal cold kind of cough?
Well, it certainly can be very difficult, particularly in young children, to differentiate, because while it's commonly known as a cough may not be the most significant symptom. And in fact, in the smallest babies, apnea or periods of difficulty breathing might be how the baby presents. So for parents with young children in particular, it's just important to recognise if your baby is generally unwell, flat, having difficulty breathing and any cough, and you need to go off and see your GP and be tested. And in addition to that, make sure that all your vaccinations are up to date.